So thanks so much for the invitation to come and talk with you today. I was asked to talk about something related to teaching or education, and I picked this topic actually because it's of particular interest to me, and really I think it's just something interesting to think about. So what I hope to do in the session today is talk a little bit about mindfulness, what it is, and also talk about some strategies related to mindfulness that you might use in your teaching. So yes, we're going to talk about what mindfulness is and what it's not, the potential benefits of mindfulness for teaching, and I'm going to draw from the literature from other settings because we really don't have specific literature in medical education. And I'm going to talk about some specific strategies that you might use to incorporate mindfulness into your teaching. So I don't have any disclosures. I will say that while I think about this a lot, I'm not as mindful as I'd like to be, and I'm going to keep practicing. Actually, before we go there, so just so I have a sense of who's in the room, so who teaches learners? Everybody. Okay, wonderful. So in general, let's say, who spends more days than less in a week with a learner? Who's teaching in clinical settings? Okay. Who's teaching in settings that aren't clinical? Can you give me an example of what those settings are? Just
research lab.
Lab. Okay, wonderful. Yeah.
Research.
Lab. Wonderful. Same. Classroom. Okay. Okay, so lots of diversity in the group, but lots of teaching in the group. Okay, wonderful. Before we get into the meat of this, I'm going to speak to you from my role in the Dean's office and also my role on the Institute for Excellence in Education Managing Board, and tell you about some opportunities to build teaching skills. So some of you may know about our teaching camp. It's a 2-day course in the summer. We have dates for next summer. Those 2 full days are devoted to developing teaching skills. You can sign up for one day or both days. We have on your top left, the Foundations of Teaching and Learning. We have 2 dates coming up for this course. This is a half day that really focuses on foundational skills in teaching. We focus on the learning environment, feedback and coaching, questioning as a teaching tool. We talk about some other clinical teaching. We talk about small group teaching, and we have a session on active, making your lectures more interactive. We have a new course for folks who see themselves progressing along the Educator pathway. This is modeled after our teaching skills workshop. This is going to be a Foundations of Educational Scholarship, and it's designed to introduce participants to the basics of educational scholarship, how and why it might be a little different from other research, and also what are local resources available to support you in that type of work. And then on the IEE website, we have a website that's called Improve Your Teaching that has different modules on different teaching subjects. You can go to that website and go through the modules at your time or as needed based on content. So if you have a lecture coming up and you want to review the lecture module, or if you have challenging feedback scenario coming up and you want to review some of those skills, you can go to the website and do it at your own time. So I just wanted to put that up there so that you guys are all aware of the resources available in the School of Medicine for you. So I want to start here, and so this really is meant to be an opportunity. We'll spend about an hour. I'll share information with you, but I really want you to think about this proposition, and that is that paying attention and being aware will help us to be more effective and engaged teachers by ensuring that teaching is a thoughtful response and not a rote reaction. I want to be really clear that this talk is not about teaching learners mindfulness practice, although there is a increasingly robust literature on that. But rather this talk is more about us being more mindful teachers and incorporating mindfulness into our teaching. Okay? Okay, so again, as I said, we're going to, just as a reminder, we're going to define mindfulness. I'm going to describe the benefits of mindfulness more broadly in medicine, and I'm going to share some teaching tips or strategies that incorporate mindfulness. So I'm going to show you 2 definitions of mindfulness. The first is from Jon Kabat-Zinn, who is probably single-handedly responsible for bringing Zen Buddhism to North America and introduced it on such a large scale. So John Kabat-Zinn defines mindfulness as the awareness that emerges through paying attention on purpose in the present moment and non-judgmentally to the unfolding experience moment by moment. Okay? And then I'm going to share a second definition that has been used in some of the research around mindfulness, and specifically in a really interesting study that looked at mindfulness as a strategy for reducing implicit bias among physicians in caring for their patients. And in this study, they defined mindfulness as a metacognitive skill involving attentional control, including paying attention to one's experience in the present moment, emotional regulation, self-awareness, and a non-judgmental and curious orientation towards one's experiences. Okay? What I want to emphasize from these definitions is that mindfulness is really a set of skills and habits of mind that can be developed through practice. I want to just show you a little bit of my own journey around through mindfulness, which initially began for me in reading some of Ron Epstein's work. Does anyone know Ron Epstein? Yeah, so he's at Rochester. He is a family medicine doc and palliative care specialist who's been writing about this and thinking about this for a really long time. He recently published this book called Attending. It's really excellent, and I really recommend it for anyone who has any interest in this. It's a very accessible read and really engaging and really resonates. So this is sort of where this began for me and thinking about it. And this is really about one of the only papers I have been able to find over time that really talks about how mindfulness can be important for medical educators. And again, it's mindfulness no different from any of the way of thinking about it in the work that we might do with patients or just in our lives more broadly, but rather describing it in the context of being an educator. So I'm just going to put this up there, and I'm going to ask you to just bear with me for a moment. Mindfulness is about creating space. There are generally 7 principles that many practitioners or teachers of mindfulness use to talk about or think about how we might think about mindfulness. And I want you to sort of look at this list. I want you to actually notice what reactions you're having to this list as you see it, or what questions are popping up for you. And we're going to come back to it in a little bit and talk about it in a little bit more detail, okay? Okay, so now I just want to talk a little bit about some of the benefits of mindfulness that have been demonstrated in 3 settings. And these are some articles that these are drawn from, but there really is a very large literature on this. So I'm going to share with you outcomes in patients, physicians, and trainees, and I'm going to emphasize a couple of them. So some of the outcomes that have been noted as a benefit of mindfulness training are reduced stress and burnout, and this has been demonstrated in physicians and trainees, increased positive emotion and energy, sometimes described as resilience, among patients, physicians, and trainees, cognitive debiasing and flexibility among physicians, greater attentiveness and conscientiousness among physicians, greater comfort with uncertainty among physicians, improved safety. There's some fascinating studies that look at things like preventing patient falls, needle sticks, hand washing, and this has been demonstrated among healthcare providers and trainees. Improved empathy and person-centered orientation to clinical care among physicians and trainees. Better ratings of communications and relationships with patients among physicians and trainees, and greater sense of community among some of these groups. And this is an article that came out in JAMA in 2009, and Ron Epstein is one of the authors on this article. And this essentially was an intervention that they conducted with physicians that self-selected to be part of this intervention. And it was basically a 7-week program that focused on mindfulness. They also, so mindfulness in terms of different types of meditation and mindfulness practice. They also used narrative medicine, so a lot of storytelling in this program, and also an appreciative inquiry approach, which is essentially a model for organizational or individual change that focuses on what you're doing well and doing more of that. And they demonstrated improvements in many of the outcomes that I showed you up to 15 months out. And I'm showing you this paper for a particular reason, in that there's an increasing interest in mindfulness in our worlds, right? Because we are faced with so many challenges, in particular among the physician workforce in terms of things like physician burnout, et cetera, right? And so in a moment, I'll tell you about a course that's offered here at Hopkins, but you will see mindfulness put out there as a way to address some of the challenges that we face. This is one piece of the problem, but it's evidence-based and has demonstrated some effectiveness, and so you will see that there's a lot of interest in this. I will tell you that when I was coming here today, I walked down a set of steps just out here that I hadn't walked down recently, and I don't often walk down, and I came upon, has anyone seen this, between the stairs out there on the other side of the waterfall there, the Clarity capsule? Has anyone seen that? No, yes. Okay, so I stopped, I noticed. It is this little cube cubby, it looks like an egg. It has these beautiful velvet curtains, and I stopped and read. There's a sign that says why it's there. It's a place to sit and contemplate, meditate, whatever you want to do. They talk about why it's there, just creating a place for anyone to go and sit and, you know, relax, meditate, whatever it might be. So I went in and I spent a few minutes in there, listened to my app that I like to use. But again, it shows you the increasing awareness of some of these benefits from mindfulness and then responses from institutions to that. So I actually recommend you check out the Clarity capsule. You'll have to take turns because you won't all fit in, but it's very comfortable. It has a nice, comfortable couch. It's very nice. Okay. Okay, so I've told you what some of the outcomes are. I'm going to show you some, this slide comes from Netta Gould, who runs the mindfulness-based stress reduction course at Hopkins, and I'll tell you a little bit more about that in a moment. We don't necessarily know exactly what is going on with mindfulness or meditation and those outcomes. We do have some, we can show you changes that occur in the brain that are assumed to be associated with those outcomes, yet the sort of final common pathway is not yet known. And so what this slide shows you is that there are different parts of the brain. It shows you what their functions are, and it shows you what changes have been noted when functional MRIs are done. And in these persons who take a 7 to 8 week mindfulness-based reduction course. And I think what's important about this is these changes are seen in persons who have been meditators for a very long time, and they've been shown in people who have been meditators for 8 weeks, right? Not necessarily the exact same changes, but similar changes, right? So the assumption is that just a small amount of meditation, right, or mindfulness practice can actually create these changes. Okay, so how can we become more mindful? Well, there are lots of ways to do that. So there's some structured ways to do that. So now at Hopkins, there's a mindfulness-based stress reduction course. There are popping up in, there are popping up in lots of different places modified courses, so shorter versions of that. The traditional mindfulness-based stress reduction course that was developed by John Kabat-Zinn, which was actually developed for patients, is an 8-week course, right? It's about 2.5, 3 hours a week for 8 weeks, which isn't necessarily something that everyone can do. There are online modules, there are mobile apps, and there are different kinds of practices such as compassion meditation or mindful communication. I wanted to show you this too, another example of something the institution is doing. So I don't know if anyone noticed this email the other day or knew that this was available, but the university covers the cost of Calm, which is probably one of the most used mindfulness apps that you can you can purchase. And so now Hopkins is paying for the premium access, which is a pretty good deal. So just so you know, you can do that. Okay, so how can we become more mindful? So I want to just tell you a little bit about what meditation can look like. And this book actually is a lovely way of reading about mindfulness in a way that connects it or resonates with the type of work that you do on a regular basis, with examples that generally resonate. So I think of meditation as attention or awareness training, where I might practice a focused attention. So I might focus on my breath or focus on some other sound or image, or I might practice an open awareness meditation where I might just notice what's happening. What does it feel like for my feet to be standing on the ground right now? What sounds am I hearing? What does it feel like to notice my clothes on my body? Those kinds of things. The other thing that you could think about are their informal practices, something that you just pay attention to on a regular basis. So, for example, in the mindfulness-based stress reduction course, one of our activities was an informal practice, and we could choose what it is that we wanted to do to pay attention to on a regular basis. So some people chose something like washing their hands. And so each time they washed their hands, they made an effort to notice. What did it feel like to get their hands wet, to move the soap over their hands, to rinse their hands? What did the air feel like against their wet hands before they dried it on the towel, etc.? You might think about when you're walking from one place to another, instead of feeling rushed and hurried or looking at your phone, you might think about just noticing one foot touching the ground after the other, right? What I chose for my practice in that course was mindfully greeting others. So sometimes we greet others and the immediate response is, how are you? I'm so busy, right? So I made an effort to specifically not respond in that way, to find a more positive affirmation. It was hard. And it also made me notice how often other people greet us in that way, right? I'm so busy, right? Think about it. Okay. So this is just a description of the mindfulness-based stress reduction, the typical course, and I wanted to just make you guys aware that Dr. Netta Gould here in the Department of Psychiatry offers this program a couple times a year. I know that some in the room have taken the course. If you are interested, you can reach out to Netta Gould. It's a really wonderful course. Okay, and so Netta loaned me this copy of some pilot data from about 80 persons who have already participated in this program. And I'm showing you this because they're very similar to the study that Ron Epstein and his colleagues at Rochester did. And also, these are your peers, right? These are your peers who participated in this course and noted improvements in the burnout, measures of burnout, their perceptions of stress. Using a mindfulness attention scale, reported feeling more attentive and feeling more engaged in their work. So these are all really, I think, compelling measures and pretty positive in terms of the benefit that something like mindfulness can have on you. And again, as I said, you needn't be meditating, excessive hours in the day. Really, this data and from other studies show that it really just takes a little bit of mindfulness practice. Okay, so you're saying, yeah, maybe this sounds okay, I'm not sure. But I just wanted to, is anyone thinking any of these things? You don't have to raise your hand. No, not so much. Okay. Does anybody want me to talk about any of these? Do you have any questions about any of these? Say it again. Yes. Yeah, so if I were a Buddhist monk, what I might respond to you, and I think that, so I might say to you, so on days I feel busy, I might meditate for 10 minutes. On days I feel really busy, I'm going to meditate for 30 minutes, right? Yeah, and you can think about it, sometimes when you're, well, in a moment we'll talk about what happens when we are so busy, right? So what are some of the outcomes related to that? I think the first one is one that sometimes people really struggle with, and I think this is just a misunderstanding of what meditation is. It's not about clearing your mind. It's about paying attention and practicing and noticing when your mind starts to wander, which it will, because that's how our brains work, right? But noticing that and bringing it back to the focus, whatever it might be, your breath, a sound, a count, whatever it might be, right? So it's not, yes, Pekka.
So my colleague right now, right in front of me, for this busyness one, just sent me a structured approach to fitting in mindfulness, and it's a program, mindfulness at work.
Oh.
Carve out 15 minutes.
Yeah.
Which, yeah, all of us are too busy maybe for 15 minutes, but once it's on your calendar, it's structured, we seem to do better at adhering when we have a little structure in our work day. And yes, I will do it.
I think that, that's an excellent point. And the other thing that I would add is even if you feel like you can't find out, you can't carve out, 5, 10, 15 minutes to actually sit still and practice sort of meditation, you can practice paying attention, right? Everyone is going to walk out of this room and go somewhere where you could practice paying attention in that moment. Okay, and I'll give you some more examples there. But yeah, so I think you're absolutely right. If you just Google sort of tips for mindfulness, it's sort of all over the place.
And there's an actual structured linked program that you can sign up for.
Oh, so there's a little bit of accountability there too. Okay, yeah, that's helpful for a lot of people too. Yeah. Okay, so, yes. Do you want me to go back to that slide?
Well, yeah.
Sorry, there we go.
As someone who has practiced it for a couple of decades, I can tell you I am more productive if I do this.
Yeah.
And the second to the last bullet, I know I'm no good at multitasking.
Right, and there are good studies to show us that we aren't good at multitasking. Can you say how you know you're more productive, or what's your sense of how that works for you?
It's part of it is I get the same amount done without feeling busy. So more productive in the sense of less effort, less feeling stressed.
Yes, yes. So
Overwhelmed.
yes, less of that feeling overwhelmed, stressed, anxious about getting it done. Okay. Yeah.
And also a couple of ways of looking at things, even with a very difficult patient, there's something good about what you learned or you did or helped them to do something, and you can, I think we can really only think of one thing at a time. So if you're thinking of that positive thing, you're not thinking about how draining you feel.
Yeah, yeah, or what's happening when you leave the room, or all the other patients you have to see. If you can focus in that moment on the patient, you can accomplish more. Yes?
One thing that I heard from a teacher was sort of thinking about being hurried versus being quick.
Mm-hmm.
Sort of two different things in the sense that when we feel busy, a lot of times we sort of feel hurried, but a lot of that is sort of self-imposed. There's this kind of our brain that sort of imposes thing on it. But the reality is that we need to be quick, and as we have to make a lot of decisions and things like that. And so, for me, it was really helpful to kind of think about those things differently in terms of our busy lives. I just wanted to mention that.
Yeah, I think that's a wonderful observation. And I've noticed as I practice mindfulness more that there are times when I feel very busy or overwhelmed, and I think, oh, I'm never going to get this done. I have all this to do. And then a little bit later, when I've accomplished some of it, all of that goes away, and I try to sort of remember in the moment, there's not that much difference between here and there, and, sort of how can I change my thinking a little bit around that, so reframing it. So that's a wonderful point. So I want to pause here, and I want to ask you guys, what keeps you from being mindful? What keeps you from paying attention? What keeps you from awareness in the present moment?
Worrying about things that aren't happening at that present moment.
Yeah, so you're thinking about yesterday or tomorrow or whenever. Okay, yeah. What else? It's very hard to be present in the moment. Yeah.
I think when you think about kind of contextualizing what you're doing in the context of all the things that you need to do now.
Yeah. Mm-hmm.
I think about it as being in my head,
Yeah.
not being in my body.
Oh, say more about that. Help me understand that more.
It's kind of like just paying attention to the thoughts that are in my mind.
Yes.
About the things that they have mentioned, like before or
Yeah.
after, or what I need to be doing or how much I need to accomplish. And then when I am not in my head and I'm in my body, it allows me to be more present and
Yeah.
kind of connect with the sensations in my body, and it
Yeah.
just helps me kind of ground. And
Yeah.
then the thoughts in my brain kind of slow down and I
Yes.
become more able to kind of be productive.
Yeah.
Pace myself and
Yeah. That's a wonderful description. I'm glad that you were able to share that, because I think that's exactly right. You're got all these things going on in your head, and if you can't just notice them and just put them here and note and then be in your body in the present moment doing what you're doing, right? That's a great description. Yeah, how about here and then in the back?
I think we all have a tendency to be able to be mindful towards things that we are passionate about or that we care about or enjoy.
Mm-hmm.
And when we don't necessarily have that same passion or enjoyment for that thing, then we are less able to be mindful. I'm thinking about just having a daughter or a baby, and that seems to be one of the things that I can always be mindful toward. And why is that? Versus the task at work that feels stressful or, X, Y, or Z. So I think when we can find our passion or love or joy towards something, it's much easier to be mindful toward that thing.
Good. Sam.
I think as healthcare providers, particularly maybe across the board, we're having crucial conversations all day long, where we're talking to patients who are going through very stressful times. They can often be hostile, upset, depressed, and a lot of that rubs off on us. And so when I think about what keeps me from being mindful, it's like planning for those conversations, debriefing myself from those conversations after I've had them,
Yeah.
and all that takes away from that mindfulness that maybe would make me more effective in those conversations.
Can I add a little bit?
Yes.
Kind of piggyback on that. I have found in my practice that using my body to meditate, to actually practice like a movement meditation.
Yeah.
Practice has really helped me kind of all that energy from the conversations that we were talking about and all that kind of charge throughout the day to kind of use my body to metabolize that energy. And it sounds really hippie, but it really works for me. And I kind of diffuse that.
Yeah.
And that's what's helped me. In my
Yeah.
practice.
That's a great point, because if you didn't diffuse it, what would happen? And we'll get to that in a moment. Yeah, let's take one more. What keeps you from being mindful?
I was just going to say, so I sort of think of a lot of the stuff that we have to do in let's say if we're reading a paper or, you're doing, say, a research project, in some ways you have to start engaging in your mind. I think the nature of what we do requires us to start thinking, and I think the hard is you sort of you get caught up in that, and it's sort of hard to, what's the cue to kind of get you out of that state? So I think just kind of the nature of what we're doing, I think makes it easy to get caught up in that kind of brain state.
Yeah, you have a lot to think about, right? Okay. So many of the things that you all just talked about are things that keep us from being mindful. We just have a lot to do. We have a lot of information coming at us. Whenever I look at this slide, I just think epic. And I feel like it is the poster child for this, right? I have a terrible headache every time I'm done spending hours on Epic, right? But that to me is what it's about. Too many tasks, too much information coming in, all kinds of choices. Somebody said we have to make decisions, choices, decisions. We get interrupted all the time in our work, right? Oftentimes we don't feel like we have a lot of control over our work environment, right? So I'm talking about the work environment often here, but this could resonate in other settings as well, right? So it's hard to be mindful when you have all of this going on. And so what happens when you're not paying attention, when you're not being mindful? You miss things? Okay. So you miss things. What else?
Like a waste of time.
It feels like time is wasted? Like,
Yeah, sometimes you could be thinking about stuff you have to get and you realize that a few minutes have passed and you haven't actually worked toward the meeting.
yeah. Okay, what else? Yes.
Well, that suggests you get hurt.
You could, or you might hurt others. You might unintentionally maybe, react, right? You might bite. Yep.
You might fail to appreciate what you have accomplished or what others are.
Yeah, you might fail to appreciate that positive thing about that patient in the moment, right? Which really is contributing to that relationship with that patient and maybe their, sort of road to wellness or health. Yeah. Yeah, that's really good. Yeah.
You won't remember what happened.
Yeah, you won't. Yeah, so give me an example of that.
Oh God, there's too many. I can't remember. Well, I just think that, we're engaging in conversation with a student or a patient or whomever it would be, and later on you want to go back and maybe give feedback or document, and you have zero recollection of what you
Perfect,
talked about.
beautiful.
Yeah.
Right on cue for the teaching part. Yes. The other big example that I hear a lot is driving. I get to work and I'm like, wow, I did not pay attention to any of that, which is really scary. Yeah.
Just gonna piggyback off of Steph's, but like not necessarily appreciating the work others have done, but appreciating yourself. Kind of get lost in whatever you're doing throughout the day. Realize like what you could have possibly learned that day.
Yes.
Like just the knowledge or the experiences, and just kind of don't even react to that.
Yeah, I think when we're not paying attention, we're not aware. We are often framing things in a negative way, and again, that can trickle down. It can, make it difficult for us to see what's really, happening, or a more positive approach. Yeah. Any other? Yes.
You forget to take joy in what you've done when others have done. I think that's one of the reasons why a lot of us feel burnt out. We
Yeah.
do a lot of work. We help a lot of people. But we forget to appreciate what we've done and what others have done.
Yeah. Absolutely. I think that's a really important point. Okay, so some of the things that you guys talked about, we're on autopilot. We tend to rely on our fast thinking, right? We just sort of respond without slowing it down, and we'll talk about that again in a moment. We might actually be unaware of biases and act on those, right? And the study that I mentioned earlier was really fascinating about using mindfulness to become aware of implicit biases that may impact patient care, right, as a strategy for changing that. We might ignore important data. When we're taking care of patients, we might, sort of engage in premature closure, deciding, we have all the information we need. Errors came up, poor communication, and, ultimately we're reacting instead of responding, right? Okay, so I want to just go back to this list of 7 sort of principles around mindfulness. Are there any, so I'm going to talk about beginner's mind a little bit in the context of teaching, but is there any of these that you have questions about or wonder about? Sometimes people think letting go means giving up, but it's really about letting go of yesterday and tomorrow in this moment, knowing that you can't act on that yesterday and tomorrow in the moment, but you can act on what's right in front of you, right? Any other of these lists that you have questions about or wonder about? Yeah.
I get all of them except non-striving when we're talking about a teaching context.
Yes.
And teaching how to have a goal.
Yes, yes. What I would say in that way is that we talked about how mindfulness is also about a curious orientation, right? So you can have a goal. You can be curious about how you get to that goal. You can be flexible how you get to that goal. You can be open to learning from your learners about how you get to that goal. So I think this is the piece. This is a little bit about being curious, right? And not being focused that there's only one way to get to that goal. Does that make sense?
Yeah.
And there are situations where one way to get to the goal is kind of important, like when someone's coding, right? But there are lots of opportunities for us to be a little bit more focused on the process and curious about the process. Yeah, does that make sense? Okay, good, wonderful. Okay, so now we're gonna transition and talk a little bit about mindful teaching. And I'm gonna break this down into 3 sections. I'm gonna talk about attention and noticing and give you some ideas and tips, strategies around teaching. I'm going to talk a little bit more about the beginner's mind and mindful communication. So in a moment, I'm going to ask you to do an exercise, okay? And actually, I think we could stay in this room. Okay, so what I would like you to do is we're going to take about 5 minutes, probably a little bit less, and I want you to write down the name of everything red that you see in this room. You can get up and walk around, okay? But don't talk to others. Okay, and just write it down, okay? And we'll reconvene. Let's do 3 minutes. I think that will be sufficient. All right, so what did you notice about how you were paying attention? What were you thinking or feeling?
I felt more awake.
Okay, yeah, okay. Yeah. Okay, good. Good. Yes?
Since I knew what red looks like, I was just kind of like scanning. And then when the red popped up, that's when I noticed it. I kind of put myself on autopilot.
Okay, so you were sort of passively waiting for the red to find you. Okay, good. How about others?
Not valuing anything that wasn't red.
I don't care about that. It's not red. Okay, yeah, good. How about, I think there was someone in the back. Yeah?
It was a little it's not competitive, but sort of like, you know, like I gotta find everything red. You know?
Yes. Yes. And did you notice that? And when you noticed that, what did you think or do or say or to yourself?
It's okay.
Perfect. Great. Wonderful. Yeah. So what he said was he noticed that he started to become competitive with himself, right? Right? I've got to find all the red things, right? And then I said, you know, well, what was that like to notice that? He said it was okay. Yeah. And sometimes when we notice things like that, we might attach a judgment to it, right? Yeah.
I noticed how many things I hadn't noticed
Yes.
in the room prior to being in here. Like things that are kind of important, like the fire alarm and the exit sign, that I completely put out of my mind, but are really valuable things, and all I had to do was take a few minutes to pay attention.
Yeah, excellent. So you noticed things that you hadn't noticed before because you were paying attention. Yeah. Anyone else want to share what that was like for them? Yeah.
I didn't realize how important those signs were. I was just more so, it was like a hyper focus on just red.
So you saw red, but not anything else.
Yeah, exactly.
You didn't see that it was the exit sign.
Yeah, I mean, I did just because I had a red.
Right, but it didn't register. Oh, that's the exit sign. That's important.
Yeah, it was like a sign and things, like, you know.
Yeah. Good. Great. Yes.
I was at ease knowing what I was looking for.
So you felt comforted knowing that you knew what you're supposed to be looking for? Is that what you're saying? Okay. Okay. You thought it was going to be a big, tricky test. But it was okay. It's good. Okay. Wonderful. So you felt comfortable having a task and knowing what the expectations were. Okay. Wonderful. Great. great. So there's no right or wrong to this exercise. It really is just an exercise in noticing, right? Paying attention. And also, though, noticing what does it feel like when you start paying attention, right? And how easily your brain can go to, I got to find all the things, or hey, that's really important, or what am I not noticing, or getting laser focused, right? But just noticing all of those, right? So just before this slide, I showed you guys an image. I'm going to show you the image again, and I just want to curious if anyone notices anything different about this image, or maybe something they didn't notice before. So what do you notice?
I see more red.
You see more red, that is true. Yeah, what else?
It's a giant letter.
There's a giant letter. Did everyone see the letter? Yeah, from the first time? Yeah, not everybody does. And you could see how if you weren't paying attention or if you were focusing on something else, you wouldn't necessarily see that letter. So that image with the letter comes from this book, Visual Intelligence. This is a really interesting book. This is written by the woman who has created all these programs that take medical students, physicians, detectives, scientists to art museums to study art, to really develop observation skills. And one of the things that she talks about is inattentional blindness, right? And, you know, of course there's an Osler quote that fits perfectly this, right? But we miss more by not seeing than not knowing, right? But this is a really wonderful book if you are looking for something to read to really kind of develop skills around this. And while her focus is on visual attentiveness, right, there's a lot of sort of mindfulness incorporated in this. Okay, so how can we take those experiences, that exercise that I hope helped you to get a sense of why paying attention is really important? How can we take this to our teaching, right? So all I would ask you to do is pay attention, right? But pay attention to a couple things, right? So in particular, pay attention to the learning environment. The learning environment is really, really important, right? Notice what's going on with your learners, what's promoting learning, what's inhibiting learning. Is anyone struggling in this learning environment, right? Right? So pay attention, notice those things. Think about when you're observing learners, right, paying attention, right? So think about being very, very intentional about observing for teaching and learning, right? So you might think about asking learners what they're working on to improve and what they would like you to observe and give them feedback on, right? And then being really focused, trying to balance the clinical and teaching hat. Sometimes that's really hard when we're in the clinical supervisory role to sort of balance those two, but sort of being aware of that, right? And then observing really with intention. So writing down, just as you had mentioned, I forget what I want to give feedback on to my learner, right? Write it down, be specific, prime yourself ahead of time, what do they want feedback on, right? Okay, so the takeaways here are think about being more attentive to the learning environment. What can you do to enhance the learning environment? And then thinking about being more attentive when you are observing a learner by asking the learner to help you figure out what they're working on and wanted feedback on, and then paying attention and providing specific details so that they can improve, right? Some other things that I like to do with learners, and while this is not necessarily teaching them mindfulness, it's using principles of mindfulness in my clinical teaching with them. So I might ask learners, especially early learners who feel like they don't have much else to contribute to the team, for example, I might ask the medical student, so I'm a general internist and I take care of patients sometimes in the inpatient setting with learners, and I might say to the medical student, you know, we've done a lot of talking about what's the best way to care for patients in a patient-centered way. When we go into this patient's room, I want you to look for anything, notice things that could help us care for this patient in a more patient-centered way, right? So what do you see, what do you notice, and what do you not see? This was brought up before, right? What do we not see? So we might go into a room, the students love this, they get really into it. And you could change the content area, right? But we might go into the room and they say, you know, I noticed that they had lots of cards from their family on the wall. or they had a stuffed animal, or they had an adult coloring book, so I think that's something they like to do, right? We could ask that patient about that, whatever it might be. Or they might say, there was nothing in the room, right? Doesn't look like anybody's come to see this patient, right? They don't have any of their own personal belongings in the room, right? So using this attention or observation as something to teach, and then we can talk about patient-centered care. How can we better serve the needs of this patient, right? I might use this in the setting of physical exam. I might specifically, ask the team to just describe what the patient looks like. We've sort of lost the art of this, right? Really describing in detail how a patient looks to them, right? You can use attention and observation to debrief powerful experiences, right? So you might take the learners back to that situation. When that patient got really angry with us, how were you feeling in that moment, right? What were your thoughts? What did you want to do? What would you want to do differently, right? Asking the learner to notice in that moment what was happening for them to create a teaching moment, right? And then really role modeling in it in an intentional way. So I might invite learners to watch me, and I might be very explicit about what I'm intending to do with the patient, right? Okay, I'm going to have a conversation about X, Y, or Z, right? I'm going to really practice, using language that this patient can really understand, and I'm going to really try to get a sense of what this patient's goals are, for example. Tell me how I do on that. What do you notice that I do to accomplish that? How could I have done that better, right? Okay, so this is about using attention and noticing to really be deliberate and having learners observe and using that to create a teaching moment. So these are sort of 4 areas that you could do it in, right? So observing the patient, physical exam, using it to debrief something that happens that was difficult or challenging or a powerful experience, and using it very explicitly to role model things that you want to teach learners. Okay, so now I'm going to shift to the beginner's mind. I think this is a really lovely concept for thinking about the work that we do with patients and with learners. So the Buddhist monk says, in the beginner's mind there are many possibilities, right? They're wide open. But in the experts, there are few, right? So this is about, holding our expertise lightly, right? So that we can be curious or open to other ways of seeing, right? And I think that this is a really helpful thing to think about both in all of our work, but particularly in teaching. And there's a couple places where I really think this is helpful for teaching. So when I'm teaching learners about communication skills and relationship building skills, really teaching them to be curious with patients, right? Using what I would call respectful curiosity to understand differences or to understand the patient's perspective, right? Asking those questions, not making assumptions, being open to whatever the conversation might take them or lead them to, right? Becoming aware of biases in the moment, right, when they're taking care of patients. Using non-judgmental questioning. Framing conversations through empathy. Sometimes if I feel like in the moment I'm having a really challenging conversation with a patient or I'm having trouble connecting with them, I might pause and think to myself, first of all, I might say, well, why am I feeling like this isn't going well? And I might say, am I assuming something that might not be true? Maybe I need to step back and recheck this. Or I might say to myself, is there another way that I could understand this story, right? I need to find a new perspective around this. I love working with medical students because they are wide open, right? They are beginner's mind. So another way to think about using beginner's mind is when you're thinking about teaching clinical reasoning with learners. This is just a very basic schema about how clinical reasoning happens, and it really gets at the non-analytic and the analytic. So this is sort of Daniel Kahneman's classic fast and slow thinking, right? So the non-analytic is really fast. This is our pattern recognition. This is what experts who walk into a patient's room sort of magically know the diagnosis, and everyone, all the junior learners on the group are sort of like, how did you know that, right? It's about pattern recognition, all of these things, right? The analytic component of clinical reasoning is when we slow down, it's more deliberate, it's deductive, we're building on information to help us collect more information, et cetera. We're testing hypotheses. And I think understanding this dual process theory in clinical reasoning really, I think, promotes us teaching this by thinking about this from the perspective of the beginner's mind. So slowing it down and teaching learners to be really thoughtful about their analytic process, and also being super transparent when we're being non-analytic and helping them understand how that develops. So with this, I sort of just think about like creating space, slowing thinking down, encouraging metacognition. So sometimes when I have learners who get a transfer or a patient from the emergency room, I might say, especially with the medical students, don't look at any of the notes that have been written. Don't look at the diagnosis. Go see the patient on your own, right? Start from the beginning, right? This is a great way for learners to really understand how diagnostic reasoning works. When I'm working with learners, I will pause often for early hypothesis generation and then testing back and forth, inviting them to think out loud. Tell me about your thinking. Why did you ask that question? I might try as much as possible to coach them or role model how I'm balancing, again, this pattern recognition and the back and forth, like speaking out loud about why one thing makes me think this way or another makes me think that way, right? And helping learners to create a mental awareness around this by using language like, well, here's my approach to weakness, right? Or here's my approach to dizziness, as an example. Or when I'm working with a learner, what's your approach to anemia? How do you think about this, right? Slow it down. You know, this idea of role modeling uncertainty, so much of what we do as physicians is uncertain, and that's something that learners need to begin to understand. And so again, you know, how do we demonstrate to them holding our expertise lightly, right? And then the last one is just a mnemonic that I think is a way of thinking about how you can slow down thinking for clinical reasoning. It's called CTO, and it just CTO. So it just reminds you of these components that can result in errors in clinical reasoning, right? But they're really about slowing it down. It's about metacognition, thinking about thinking. So second opinion, this is really a recognition of, you know, my limits of knowledge or memory, right? So do I need to ask myself, you know, do I need help in this situation, right? Is there something that I need an expert to help me, someone who sees this diagnosis all the time who could say, yes, no, here's what you need to do next. I might want to slow down if I'm you know, really relying on my non-analytic, right? My fast thinking, so that eureka moment, right? Is this pattern recognition? But I really have to ask myself, well, you know, what data doesn't support this? What else could this be? Which leads to anti-evidence. You know, what other data am I ignoring? Again, thinking about the process of clinical reasoning. Sometimes it might just be, you know, am I overconfident here? Should I slow it down? And then what else could I be missing? So there's a lot of overlap here, but again, ways to slow down the thinking. And again, I think we can train our learners to similarly slow down their thinking. Okay, so the last piece that I want to talk about is mindful communication as a teaching strategy. I really like this quote, and you can, so most people do not listen with the intent to understand, they listen with the intent to reply. So you might imagine how many times you're having a conversation with someone and you just can't not talk. You have to say something or fix it or give advice or whatever. We're often, you know, that's our jobs. That's what we're supposed to do. I just want us to think about that because there are times when this can get in the way, right? So what we're going to do right now is we're just going to do a quick exercise around mindful communication. So I want you to think about a time when you were not as mindful as you might like to be. What are some of the factors that made it difficult to be mindful? It could be any situation. What were some of the consequences? If you want to write something down, you can. And then I'm going to ask you in pairs to share your stories, but there are very specific instructions, expectations about how you're going to share your stories. So one person is the storyteller, and the other person, the listener, should spend most of the time listening. You may ask questions to deepen understanding, and I would encourage you to think about using curious questions. So these are questions that only your partner could know the answer to, right? And as much as possible, try not to interrupt or interject your own story or interpretation, advice, or fixes, right? And because again, we when we talk to people, we listen for something that resonates with us, something that we can share related to that, okay? So what I would invite you to do as you're listening to a story, each time you feel like you'd love to interject something, I just want you to sort of take that feeling and that thought and maybe that idea and just like set it down gently next to you on the table. It will still be there. You can come back to it if you want, but just consciously be aware of that urge and just set it aside without judgment, right? Because it will happen. That's how we function, okay? All right, so I'd like you to go ahead and get started. We're going to take maybe 2 minutes to think of a story, maybe jot some notes down, and then I'll invite you to talk in pairs, okay?
So you're trying to get both people to do a story or only one?
If we don't have time for both, that's really okay, because there's benefits to both parts of the exercise.
Your partner left you.
Evidently.
Okay. If you're ready to tell your story, feel free to get started, but please try to follow the instructions. if you want to switch partners and take on the role of listener if you were the talker, or talker if you were the listener, go ahead and do that. Okay, I'm going to ask if we can all bring our attention back to the front of the room. I'm going to interrupt your stories. So, I want to ask, I hope that you were able to follow the instructions. And I'm curious to know, for those of you, so who was predominantly a listener? Great. Okay. So what was it like to listen mindfully?
Comfortable.
It felt comfortable? Okay, good.
It was hard.
So it was hard. Why was it hard?
I'm an interrupter when people like to talk. Usually I like to, engage in conversation like that.
So in this exercise, were you able to be a little bit more aware of that? And okay, and typically, are you aware of that?
Yeah.
Yeah. And do you attach judgment to that usually? No. Okay. I'm just asking. Okay. Wonderful. So you were really kind of mindful of that in the moment. Was it hard not to interrupt?
Yes.
Okay. Could you actually think in the moment of, okay, I have this thing I want to interrupt, and I'm just going to set it over here for the moment, and really focus my attention on my partner?
Yeah, but I think the hard part about it is that you feel like you have something really important to say in that moment, and you don't want to forget it and go back to it later. And then frequently you'll just say like, oh, I'm gonna note this down and tell the person later. And then by the time I go home, I'll realize that I didn't tell the person what I wanted to tell them because I was being mindful in that moment.
Okay. And what did you notice about your listening? What did you hear or? Okay, so definitely some more connection or being a little bit more in tune with the speaker. Okay, great. Other listeners?
Yeah, well, your story was so interesting that I was fascinated. I was pretty sure I didn't have anything to add other than when you finished, I said, what'd you do next?
Great, perfect. That's a curious question. You couldn't know the answer to that. Wonderful, and that keeps the story going. Terrific. Okay, great. Others listening?
In this context, I found it refreshing.
Okay.
I agree. Maybe I'm an interrupter too, but I'm also planning how I'm going to respond.
Yes.
And knowing that wasn't something that I was expected to do.
Yeah.
It was nice
Sure.
to just be able to sit there and not have to give any sort of feedback
Yeah.
in that particular scenario. And I definitely feel like I heard more of the details, and I think I sympathize more, and I was also able to think a little bit about my own experience and how I would do things differently if I were in that scenario.
Great, that's great. Okay, let's take one more listener, and then we'll hear from a speaker. Yeah.
I think as clinicians, we're often so focused on treating and getting to the next step of that treatment. So as soon as someone gives us some little bit of information in our practice, we're automatically going to how we can best serve them.
Yeah.
And that's often kind of the culture where we work as well.
Yeah.
How can we best serve the patient?
Yeah.
But when we're kind of given carte blanche to just listen and not focus on solutions, we really understand the problem a lot more in terms of the details of what maybe led to the difficulties the person was experiencing, how they're currently processing that even in the moment as they're recalling it. And then that would then lead to a more effective solution later when it's appropriate to make that solution.
Yeah, that's great. Thank you. All right, so who was a speaker and would like to share something about what it was like to speak in this exercise? Anyone? Yeah.
I guess I found myself hoping that I would actually at some point be interrupted. I felt like I was rambling, and at some point I was thinking, okay, I need to stop so that they can say something. So it was modicum of discomfort, I guess.
Yeah. And you notice that discomfort. Yeah. That's interesting. That's not the first time that I've heard that, right? Yeah. So we're not used to being alone with our thoughts and words. Yeah. Wonderful. So a little bit of uncomfortable. Did anyone feel comfortable? Like appreciated being able to share their full story? Yeah. Yeah. Yeah.
It was nice to talk. I was talking about something that happened to me at work, and because I was talking to somebody who works in the same profession, I didn't have to put context into it, because I realize now that when I talk to people, I always try to put context into it instead of just getting to the heart of the matter, because I think people aren't going to understand me if I don't put it in context.
Interesting. Okay, great. That's good. All right, one more. Yeah, in the back.
I definitely felt the pressure of, oh, I need to make this story interesting. Not because my listener was an excellent listener, but I was suddenly like, oh my gosh, my story is actually kind of stupid. And, you know, like I was kind of forced to hear myself and listen to myself more because someone else was being subjective.
Yeah, so one thing I would say is when we pay attention, sometimes we begin to attach judgments to what we notice, right? And so one of the pieces of mindfulness, right, one of the practices is really trying to approach that with non-judgment, just noticing it. Isn't that interesting? That I should feel pressure to keep talking or to make an interesting story, right? That's hard work. That takes a lot of practice, right? Yeah. Okay, super. All right. So how could we think about this kind of communication in a teaching setting with learners? Well, what if we use this in feedback, right? What if we invited a learner to share their perspective, right? And we approached it with curiosity, right? They might do a lot of the talking and actually come up with the issues and the solutions on their own, right? When we trust our learners, because in many situations, they can do that, right? We can use this type of language when we're coaching learners about getting better at something, right? Right? Figuring out what their perspective is, what's their frame, how are they understanding what's going on to help them maybe see it a little bit differently to improve, right? It might be helpful when we're working with a learner who's really struggling through remediation, right? Or around more challenging issues like professionalism, right? Or, you know, when debriefing mistakes, errors, critical events, right? This kind of language, really listening to others. The other way that we can use mindful communication is when we're really thoughtful about how we use questions, right? We use questioning a lot in medicine, right? But we can use them, I think, a little bit more mindfully, right? So we can use questions to assess a learner's goal in learning, right? So what are you working on? What would you like feedback on? What are some learning points for you today? What is still unclear, right? Maybe assessing where a learner's learning stance is, right? Is there anything going on for you that's making it hard for you to focus on your learning, right? Maybe using questions in a way to probe deeper learning as opposed to just have them feed you back information or a list of causes of an illness or whatever it might be, but to really have them think through processes, right? Explain your thinking to me. How is this situation with this patient different from that other patient, right? What will you think will happen? What do you think will happen if we treat with this, or if we stop that medication, right? Or if we make this recommendation, right? I think mindfulness is a great sort of metaphor for making space for learners to respond, right? And valuing their responses, right? And really avoiding the sort of what am I thinking question, right? Where there's only one right response, right? This is, I think, the non-striving piece, right? Okay, so that sums it up. So I'd love for you to think about mindfulness, incorporating more mindfulness into your teaching, right? And I would love to hear if you would like to share something that you learned today or something that you think you'd like to do differently in your teaching or just in general based on the discussion that we've had together. And we have 1 minute to do that. I try to stay mindful of the time. Yes?
I want to listen more with the intent to understand and respond as opposed to just
Yeah. Wonderful. Keep practicing. I'm practicing all the time. Yeah. Is there, did you?
Yeah, just being less focused on the clock. And
Yeah.
in a moment, it's okay that 2 or 3 extra minutes that you spend doing something is not going to totally throw your whole day off, but may actually make it more productive, and that's being attentive and not worrying about time.
Yeah, good.
I like the idea of asking, when you're working with students, asking questions that only they know the answer to. I think oftentimes we get stuck, or I get stuck in this pattern of asking questions that I also know the answer to, and so I want to see if they have the quote-unquote right answer, and so
Yeah.
trying to focus differently on questions that they only know the answer to, and that we can just have a conversation about.
Yeah.
I learned that the less time that you think you have to be mindful is the more time you should probably spend being mindful.
Yeah. Yeah.
I'd like to share one thing that I already do, the much maligned EPIC. You know, before we click print after visit summary, we're supposed to answer, is there anything else I can do for you, or anything else you want to tell me or ask me or something?
Yeah.
And sometimes they've been working on something the whole visit. I call it a doorknob communication, that you almost have your hand on the doorknob, and they say, oh, one more thing, and it might be the most important thing of the visit.
Yeah. Yeah. So making space for that, right? Yeah. Good. All right. Well, thank you all very much.
Thank you.
I enjoyed being with you.